Your state and federal tax dollars are paying for thousands of Tennesseans to use the emergency room, but not for actual emergencies, instead far less serious health issues.
Everything from headaches to toothaches. Our community watchdog investigation revealed those non-emergency ER visits are costing you tens of millions of dollars every year.
More than $84 million in 1 year alone, to be exact. We're talking about at least 126,000 ER visits. The most recent available numbers show not only is the problem getting worse, people in East Tennessee are costing more than any other part of the state. We requested the yearly cost breakdown for TennCare funded ER visits considered non-emergent and found those visits are costing Tennesseans more than just money. Their health is suffering too. The emergency room. By definition, a place staffed and equipped to treat people who need immediate medical care.
That really is for life or limb threatening issues.
Not patients battling the common cold.
As a provider, I completely understand why individuals are, using the ER.
But thanks to the ER's convenience, TennCare records show the state paid almost $5 million alone for viral and acute upper respiratory infection ER claims in fiscal year 2016. More than $4 million for headaches and $1.5 million for strep throat. And the more cases you add to the list, the closer the total climbs to almost $85 million.
Gosh, can you imagine what we could do with that money?
We shared our discovery with Lisa Shanklin outside the Johnson City Community Health Center.
It's unbelievable that people go for a headache or for a toothache or nausea.
A place that serves uninsured and underinsured patients.
I've been here at least 20 times.
Even with multiple disabilities, she says she only goes across the street to the ER when it's a legitimate emergency. For every other health issue, Shanklin says she picks a more specialized, more affordable alternative.
But I know with my income that it's only $5 to see a practitioner here.
This is a long-term problem.
TennCare Chief Medical Officer Dr. Victor Wu says the state's Medicaid program is trying to come up with a solution, working to convince its 1.5 million patients, which include low-income pregnant women, children, the elderly, and people with disabilities, to get regular checkups with a primary care physician, not just go to the doctor when they are sick.
I think if we can begin to turn the tide more toward prevention and turn the tide more toward focusing on wellness, I think that will help, in general, offload some of the challenges we see when people do get sick.
In addition, he says TennCare is increasing patient interventions, including face-to-face meetings, phone calls, text messages, and letters, and working with hospitals to help direct patients through the proper path of care.
It is really challenging.
TennCare also reports it implemented a new policy several years ago that caps the amount of money it reimburses hospitals at $50 per non-emergent ER visit, a way to incentivize them to better educate the public. But these numbers show more education is needed. There's a problem here, right?
Yes.
Yes.
TennCare records show the cost increased by 25% from the previous year, with East Tennessee responsible for more than $30 million of the total expense.
It's an opportunity. It also is a signal that there's definitely a misunderstanding of the purpose of the emergency room.
Mountain States Health Alliance's A New Care Collaborative has spent the last several years trying to drive the message home that primary care is not only more affordable, but ultimately better for a person and society's overall health. At the ER, doctors aren't specialists in treating chronic health problems. They're focused strictly on emergency care and oftentimes only have a snapshot of a patient's medical history.
I think we really have to reorient ourselves to the emergency room is for life or limb-threatening situations, and is this one of those situations? Can I wait until the morning?
Dr. Sherry Raju and Paige Yonkin say Mountain States is also trying to give patients support so they can call their care coordinator for advice about how best to treat their health issue. The group is targeting certain patient demographics, using disease-specific initiatives to spread the message, and trying to make primary care and urgent care more convenient.
We're working on establishing easier scheduling open scheduling, maybe looking at different hours so that they're more flexible, so the patient is able to go there as opposed to the emergency department.
Even with all of these efforts, the chairman of the Senate committee in charge of TennCare oversight,
it really is troubling,
says there is only so much the state can do. Senator Rusty Crowe, like his counterpart in Congress, Representative Phil Rowe, told us states need flexibility too. Flexibility, they say, will only come from federal health care reform.
The federal laws restrict our hospitals with regard to what we can do with Medicaid patients. Untie our hands and let us do what we need to do at the state level.
Back at the ER, non-emergent visits aren't just costing you money and costing TennCare patients better care.
It just increases the wait time.
They're also tying up this critical service, delaying care for people who really need emergency help. Nate Morabito, News Channel 11, in your corner.
The question, in all this is, so when should you go to the ER? When should you go to urgent care? When should you wait and call your physician? Mountain States shared its Where to Go guide with us. You can find it on our website. It's at WJHL.com. An important note, experts say if you are unsure whether your health problem is life-threatening, you should always err on the side of caution and go to the